Well, it's time for our Africa Health Network report. Joining us now is Africa 54 Health correspondent Lino Mudu with a look at gynecological cancer. Hello, Lino.
Hello, Vincent. Hello, everyone. September is Gynecological Cancer Awareness Month. Unfortunately, many women lose their lives to the diseases. But if the cancers are detected early, well, patients can often beat them and thrive. Cervical cancer and cancer of the uterus. These are just two of several gynecological cancers that women can develop. Cancer of the cervix is the second most common in women worldwide, and the World Health Organization says 80% of cases occur in low-income countries. Dr. John Varallo is Senior Technical Advisor at JPIGO.
Cervical cancer is, it's a huge health issue in Africa and globally. It's the leading cause of cancer mortality among women.
Cervical cancer is a cancer that starts in the cervix, the lower narrow end of the uterus. The human papillomavirus, or HPV, is the main cause of the disease. Experts say HPV is a common virus that is passed person to person during sexual intercourse. Dr. Varallo says the incidence of cervical cancer has increased on the continent due to HIV/AIDS.
It usually takes at least 10 years from the HPV infection to going through the precancer stage to cancer, on average. For HIV, we know that time frame is accelerated.
Experts say it is possible to save the lives of patients with cervical cancer, but early detection is key. However, in some settings, there are not adequate resources for screenings and treatment. In addition, many women are not aware of cervical cancer and they need to get checkups. Lack of awareness is also an issue with uterine cancer. That is the case here in the Democratic Republic of Congo.
When it comes to uterine cancer, I don't know anything about it. I've heard that it exists, but I don't know anything else.
Dr. Deogracias Ngabo is with the Charité Maternelle General Hospital in Goba in the DRC.
We conducted a study here in Goma. We found out that many women did not know the signs of uterine cancer. They did not know when they needed to go for checkups. We also do not have adequate means to screen or detect the cancer.
Uterine cancer is also called endometrial cancer. The disease begins in the uterus and frequently produces abnormal vaginal bleeding. Goma resident Luis Matinda has experienced it. Her daughter Esther explains.
She bled on a daily basis for 4 years, so we decided to bring her here. When we arrived here, we took her to a local healthcare center where she was examined again, and we were told that it's a problem of the uterus.
Most cases of endometrial cancer are diagnosed in women over age 60. Just like cervical cancer, uterine cancer can be treated effectively if detected early. And for more on the subject, we are joined by Dr. Larry Maxwell, Chairman of the Department of Obstetrics and Gynecology at Inova Fairfax Hospital, just outside Washington, D.C. He's also director of the Globe-athon to end women's cancer. Dr. Maxwell, welcome to the program.
Thank you so much for having me.
In the report, we talked about cervical cancer and uterine cancer specifically, but there are many more cancers when it comes to gynecological cancer. Tell us about some of the other ones.
Right, so we have cervix cancer, uterine cancer, and ovarian cancer. Those are the most prevalent. But then we also have vaginal and vulvar cancers. And so those 5 collectively are the ones that we most target.
Now, one thing is, for me personally, as a woman, when I go to see my doctor, I'm told to get a routine pap smear screening for cervical cancer. But something that I don't hear often, whether it's myself or even in general, is to get a routine screening for uterine cancer, ovarian cancer, and some of the other cancers you mentioned. Is it because there's no technology, or does it depend on the age? Why is there such not enough awareness about the other cancers?
Well, quite honestly, it's technology and development. I don't think that we have anything that has clinical utility to where we can have screening tests for these diseases, short of having an annual pelvic exam. So I think that even though we don't have a pap smear for uterine and ovarian, a lot of these cancers can be detected as part of annual and serial follow-ups. I think women also, in addition to going for their evaluations, they need to listen to their bodies. They need to listen for symptoms and signs that could be indicative of an ovarian cancer, like bloating, abdominal discomfort, change in their urinary frequency, or for cervix cancer, having abnormal bleeding, discharge after intercourse, and then with uterine cancer, having any kind of bleeding after menopause. These are clues that should prompt women to seek out specialty care.
Okay. Now, an initiative that you are heading is the Globe-athon to end women's cancer. Tell us more about that. Are you focusing on gynecological cancers in general?
You know, we are. I think that the overall campaign is an effort to end women's cancer. We're not exclusive of breast cancer organizations. We do have an emphasis, though, on gynecologic malignancy. That's something that the cancers below the belt just haven't had a lot of discussion. And so we want to change that dynamic. And we've recognized that working independently we can achieve a lot, but really working together we can empower ourselves not only to better serve our patients, but to better communicate these issues to our governments and policymakers.
And I know it's a global event. There will be some events in Zambia, Ghana, and other countries in Africa and around the world.
We have over 80 countries committed this year, over 90 committed for next year's event in 2014. And within these 80 countries, we have events in over 160 cities. So I believe we have 13 countries in Africa. Next year's efforts are really going to be at trying to bring everyone we can on board into the events.
And quickly, before we end, ending women cancer, is it possible at all? What are the steps in general?
I think that the steps are educating the public, getting them to embrace preventative measures, particularly with cervix cancer, is educating people to receive the vaccine. And even in the U.S., where we have the vaccine available to most everyone, only about 35% of the population have been vaccinated at young ages. So it's not just having the resources, it's having the program, the leadership in the country, both at the physician level, the advocacy level, and the public health level, to make that opportunity a success.
And now the message that I take from the gynecologist that you are is listen to your body. Indeed.
Listen to your body and act on anything that you have that's abnormal.
Dr. Maxwell, thank you so much for joining us today. And that was Dr. Larry Maxwell. He is chairman of the Department of Obstetrics and Gynecology at Inova Fairfax Hospital near Washington, D.C. And that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com. Back to you, Vincent.